Welcome back to this section, which is health and safety. Now, the health and safety that we're going to talk about, I want us to think about our current roles with providing care in people's homes. So as we go through this, we'll link it back. So this is standard number 13, unlucky for some, but hopefully not unlucky for you, and we'll get through this as quick as we can. Now, here we're looking at legislation that we've already seen across the other standards. We've already talked about Health and Safety at Work Act 1974. But let's look into this a little bit more deeply. The reason for Health and Safety at Work Act is to protect the people at work and those that are affected by work activities. Legislation, such as the law, is that everyone knows in society and behaves in an acceptable manner. So it's ways of working to reduce risk. The legislation here is obviously statutory guidance. It's important that you're aware that when we talk about health and safety at work, it is a legal requirement. Under health and safety at work, there's multiple layers of legislation. So we have the main act, which is the 1974 Act, and we have then RIDDLE, the Reporters of Injuries, Dangerous Disease Occurrence Regulations. And this is the one in where we're going to report concerns to the Information Call Centre, the ICC, and there'll be things such as if we've got an injury or a disease that's kept us off work for more than 7 days, if we've lost a limb or an amputee, we report it, or if we've had a sudden illness from another country, we report it to RIDDLE. So it allows the country an opportunity to manage risk. We have the Management of Health and Safety at Work Act Regulations 1999, and again, that looks at the carer's workplace and providing the right resources and equipment. We have the fire standards, the Regulatory Reform Act, Fire Safety Order 2005, and that places a duty of care to ensure that we have control measures to raise an alarm and to know what to do. The problem is you're going to be providing care in people's homes. So actually it's a little bit more complicated because you're not going to have fire alarms, you may not have any fire safety equipment, and again, you need to know how to tackle the fire and how to get out. If you're in social housing or social or community flats, there may be equipment around in the normal environments, but in other people's homes, it's important to know whether or not they have smoke detectors and firefighting equipment. We have the Controls of Substances regulations, so again, 2002, looking at controls of substances, so when we're cleaning in people's homes, that we're aware of those chemicals and we're wearing the right PPE. So bleaches and things if we're cleaning bathrooms and toilets, etc. We have the Manual Handling Operations 1992, which basically looks at what we do as carers, and it suggests things that we shouldn't be moving or handling people unnecessarily, and we have equipment to help to lighten the load. We've then got working equipment 2002, which looks again at equipment that we might be using. So if we're using hoists, if we're using stand aids, that the equipment is being checked, that the batteries aren't corroded, that the power cables aren't loose, and that the electrical equipment and the power running through is safe. We have the Lifting Regulations Act, because again we're using manual handling equipment, that looks at the legislation around those. So have we got risk assessments in place for the hoists and the beds, and are you trained to use those correctly? So let's look at health and safety policies and procedures agreed by your employer. It's important for you to access the policies, which is the actions we must follow, and the procedures in the way that we carry out the tasks. It's important that you don't start adapting your own procedures because these have been written to provide safe ways of working. Procedures may look at how to give out medication, and in line with that you'll have the Medication Act, handling medications. It'll have things around COSH and managing chemicals. How to provide personal care, reduction of infection control, the right use of PPE. How to lift and carry loads, so the moving and handling regulations and LOLA and all those other policies there. What to do in the event of a fire, so knowing how to get out of your buildings, what equipment you can use. Do you have personal evacuation plans for each customer in the homes that you're going into? It talks about the provision of first aid. The reality is you're going into people's homes and they may not have any first aid equipment at all. So are you carrying a small first aid pack just in case you find somebody on the floor or you injure yourself in their home? And finally, soiled clothes or linen. What are you doing to reduce the infection of handling incontinence items that are soiled, maybe with incontinence or double incontinence? Are you putting those into bags ready to be washed, or are you putting those straight into laundries? All of our policy and procedures will give you clear guidance, and again, you can get those online, download them and read them. And when you go out and provide care for the first time, you'll observe some of these in practice and you'll know what to do. So who's responsible for health and safety in your workplace? There should be a health and safety poster up in every single service, and you'll be able to see who's responsible, so you'll have a name and a contact, and it will give you the phone numbers and the email addresses of the health and safety executive, so you'll know who to contact. Other people that you could talk to may be colleagues or trained professionals, people that have done MVQs, or even your care managers who have got some experience around health and safety. But it's important we work with others. Your employer has a legal responsibility to make sure that they provide you with the right equipment, the right risk assessment, and the right welfare facilities for you to carry out your tasks. It's important that they provide you a safe place to work. Now, you're working out in the community, and that makes it a very challenging environment. You've got traffic, you've got darkness, you're at the risk of lone working. So we need to apply basic, sensible, common sense approaches. So when we're going from home to home, we haven't got headphones in. If we're working earlys and late, people know where we are. You can have GPS tracking on your phone so people can follow you, and you're able to ring into the office and people know where you are at all times. It's not a big brother approach. It's an approach to keep you safe out in the community, because you have a different set of risks of people in a building. You may need, or you will have to have, specialist training. You'll have to have training for food safety, which will be every 3 years. You'll need training around first aid. If you do the regulated classes, that's 3 years, but updated annually. You'll have to have specialist training on medication, specialist training on infection control, and specialist training around other certain health conditions. We can look at the 6 C's and again link this back to competency. Because there is so much mandatory training, it is down to you to identify if you're able to carry out tasks or not and ask for help. It's important to know where to go for additional support around health and safety. You need to know what to do around sudden accidents and illnesses. Again, you'll see those policies online, and most companies will have an online reporting form. Remember, most of the accidents that happen in the workplace will be slips, trips and falls. So it's important we know what to do with those. It's important that you know what to do with sharp objects. So if you do get a needle stick injury, you're aware that you need to report it and bleed yourself to reduce the risk of infection, and go to an emergency department to get some kind of prep immunisation to help reduce your immune system. You should know what to do with burns and scalds. So again, cooling them down, run them under water. You should know how to operate any specialist equipment. So that might be things such as tracheotomies, stomach care, peg feedings, or any other health-related things. So it's important you're aware of how to deal with lots of potential illnesses. Equally, you may have sudden conditions such as diabetic comas, epilepsy, fainting. So these are health conditions and which are common into the healthcare provision. So it's important that you do your diabetic training and understand how to work with seizures if you're working with somebody who's epileptic. For bleeds, it's important you know what to do, and again, if people have a history of strokes and heart attacks, that you're aware of the treatment plans for those, and again, they should be in the care plan, and you should have your first aid principles and risk assessments done. We've already talked about the first aid training, and it's important that you upskill in that area. So if you are in a situation and you need to call for emergency services, it's important to remain calm. The emergency services need to know the situation and the background. They'll need to know what you've done, if anything, and they'll give you recommendations in how to provide treatment and care. Clearly, we know our customers, we know their previous health conditions, and we know the likelihood of ill health. Therefore, it's important that we can carry out those risk assessments. You're aware from the other standards about the 5-step principles for a risk assessment, but we'll go over them again. The first one is to identify the hazards and the tasks in hand. We need to identify who is at risk and who may be harmed. We need to look at the methods in place to control that risk. We should record our findings and remind everybody and keep them updated. And finally, we need to review them regularly. We're aware that a hazard has the potential to cause harm, and a risk is the likelihood to cause harm. Reporting health and safety risks is an important part of managing hazards. If you don't report them, people aren't aware of them. It's as simple as that. So please make sure you know your policies and procedures for reporting hazards. Equally, it's important to work with agreed ways of working. You covered this again in your first set of standards. Make sure that you're following the correct procedures. If you carry out a procedure in a way in which you weren't trained, you will not be insured. So please make sure you are not undertaking any task that you are not trained in or you are not competent in. Go back to the 6 C's. Let's look at moving and assisting people. Moving and assisting people is a complex task in which you must be trained to do. It's important that you know how to move and handle people safely without putting yourself at risk. You don't want to injure your back or your knees or injure the other person. You should know how to assist people from a bed to a chair and a chair to the bed, and assist them to take normal tasks such as washing and dressing and using the toilet. The reality is, carers work too hard. We make things difficult for ourselves. We need to go back to the enablement model and back to promoting independence and encourage people to do as much as they can for themselves. So the new processes for moving and handling is hands off. Only do the task if it absolutely has to be done. Think about the ergonomics, your body, the strain that you're putting on you on every day through constantly moving things. You're bending your knees all day up and down, and you're putting strain in your back. So when we carry out our job roles, think about ways of working in which we can reduce the amount of up and down. An example of this could be, if I'm dressing somebody in the morning, I'm going to have my flannel ready, my towel ready, my washing material ready, I'm going to have the sink ready, I'm going to have the clean underwear ready, the incontinence pad ready, I'm going to have my PPE ready, I'm going to have my clothes ready, I'm going to have my socks ready, I'm going to have the underwear and shoes ready. So it's all at the working height. I haven't got to keep going up and down, and I can do that task in one movement and not several, because you're going to injure yourself and wear yourself out. Equally, use positive language, promote people to be more independent, allow them the opportunity to move. It may take a bit longer, but it's safer. Remember, you are not a walking aid, you're not a crutch, you're not there to be leant on, you're there to simply provide confidence and support. If people are weight bearing on you, if they're leaning on you, if you're having to push people, then you're going to injure yourself. It's simple, we don't want you to do it. Medication around healthcare and activities, it's important that we understand the whole medication cycle. So ordering, we need to make sure that we're aware of how our customers are going to get their medication. It's important that when we receive the medication into somebody's home, we're checking that off against the prescription and we're checking the physical stock matches the prescription. The reality is pharmacists can make mistakes. Doctors can make mistakes. You are the last line of sensible and defence, checking that an error hasn't occurred beforehand. So if you look at a dose and you think that sounds like too many tablets, then you need to do something sensible. Ring the office up and tell them that you think you've spotted an error. Medication needs to be secured safely. This is an item that falls under COSH, the Controls of Substances. Therefore, they shouldn't just be left lying around for anyone to pick up. They should be controlled in some way. Administering, ensuring that you're giving the right dose to the right person at the right time, involves communication. It involves consent. It involves capacity. And you've done other training around those. Making sure that they swallow the tablet is absolutely key. If you sign a MAR record, a medication administration record, you are confirming that that tablet has been taken in line with the guidance. Therefore, it's important to ensure you're watching the tablet from dispense to administering and swallowing. If the tablet's in the mouth, give them a bit more fluid, ask them to show you the mouth so you can confirm it's been taken. Recording. If you sign the MAR sheet, you are signing to say that that's been taken and given. Transferring the medication needs to be you observe this all times. You can't give it to somebody else and you sign because you haven't seen that that medication was taken. And finally, disposal. If it's been refused, if it's been dropped, if it's been rejected in any way, know your procedures on returning those medications back. It's important that you have read the medication policies and procedures and you know what to do when handling medication. Again, you will be observed dispensing medication or giving medication to a customer and then you'll be signed off. Hazardous substances in the workplace require you to understand the chemicals and cleaning material in the homes. You're going to be using chemicals and substances to clean and disinfect. You'll be cleaning worktops, you'll be washing up, you'll be sterilising beds, you'll be doing lots of things. Please make sure you're following the standard infection control procedures. You're also going to be dealing with hazardous substances such as urine and faeces and spit and mucus. It's important you have good PPE when managing those. Again, I see it all too frequently, people throwing used incontinence pads on the floor, throwing wet sheets on the floor. It's completely unnecessary and a complete spread of infection. Keep your bags to hand, so put your used incontinence pad in a carrier bag. Reduce the spread of infection. Sheets and dirty laundry, put it straight into a laundry bag or into a washing basket to go straight into a washing machine. Think about the infection control, cleaning that once you've done it because it's had soiled linen in. It's important that you use your gloves and your aprons when undertaking any task that has the potential to cause harm to yourself or others. You need to be aware about storing chemicals and how they're done and the way to dispose your waste. Now, in a nursing home or a care service, you'll have different coloured bags for different tasks. You'll have a white bag for normal laundry, you have a red bag for soiled clothes, for incontinence or faeces. You'll have different colour bins and again different colour otherware as well. It's important for you to know your home's infection control procedures. The reality in customers' homes, we don't have those items, we just have what's in their home. But we still need to be mindful and work in a sensible way. Fire. Fire has the potential to cause serious injury, loss of life and death. And we've seen national disasters and we've seen disasters locally such as the Grenfell Tower around what fire can do. It can destroy families and pull communities apart. It's important that when you go to people's homes that you take responsibility for the environment you are in. We're aware of how the fire triangle works. We need fuel, we need an ignition, and we need oxygen. And if we can take one of those away, we have an opportunity of putting a fire out. But what's even better is trying to find ways of not starting that fire in the first place. The reduction of smoking. Yes, we're aware it is people's choices. I'm always concerned when I go to people's homes and I find sheets and duvets have burn holes in them. There must be other ways in which we can promote people to smoke and fulfil their rights and choices, that doesn't compromise their safety, and therefore risk assessment should be done. We shouldn't have fire doors propped open because, again, the automatic fire doors shut in case of a fire and have burn times on them. We shouldn't allow waste to build up in bins. It's bad for infection control procedures, but it's also bad for fires. Outside, in communal areas, we shouldn't have rubbish near the buildings because, again, from an arson point of view, we're just giving people the ability to fuel fires. It's important for you to know your escape routes. Every single building you go to will have different routes. You're not experts in every building that you're going to enter. So please make sure one of the first things you do when you walk into that building is know how to get out of it. Check that things are turned off at night and look at plugs. We're all guilty at Christmas for having extension leads that are overloaded, but there are homes and we decide those risks. The reality is we know they're dangerous and we should be passing that information on. Our homes aren't as safe as commercial buildings because they have regular pack testing and they have regular fire drills and ways of managing risk. It's important you know what to do. Let's move on to working safely and security. We can all become victims of crime. It's important that we know where you are at all times in the community. Not because we want to keep an eye on you, but because we need to know where you are for a safety point. We need to know that you know what to do if you become a victim of crime. Please make sure you have read the policy and procedures for lone working and you're aware of what to do. Most mobile phones now have tracking apps in which we're able to know where you are. So such as Google Maps will tell us we can log in and we can see where you are. Most of the phone apps now that we use for care planning systems will track you electronically. It may feel a bit like Big Brother, but it's important we know because at least we have an idea of where you are at all times. In the mornings, it's useful for us to know when you've left your house, so we know you're on your way to your first customer. And when you finish your last care call, it's important that you phone up the office and let us know that you've finished. So at least we know you've left work and you're on your way safely. If you're going to people's homes and you feel threatened, again, it's important for you to work in a safe manner, making sure that if you feel at risk, you've escalated this, that you understand physical intervention or ways of reduction of being in conflict, and you're aware of the care plans and the procedures to follow. Moving on to yourself. We all work in a very stressful job. There's no getting away from it, from the carers right through to management. It's important we look after our own health and well-being. You're able to undertake the level 2 first aider for mental health, and that will give you an idea, or a much more detailed idea, of managing signs and symptoms of depression and anxiety, and then looking at some treatments and interventions for it. Work-related stress falls under the Health and Safety at Work Act. We have to find ways of reducing it to enable you, A, to enjoy your job, B, to feel fulfilled, and C, to promote your health and well-being. Other triggers around stress will make us make unwise choices. It reduces our tolerance level, and therefore we may act, say and do things that we wouldn't normally always do. Therefore, it's important to realise that if we're coming from home and we're going to work, and maybe we've just left home and we've had an argument, that we're still going to be carrying some of those feelings and emotions. It may be the fact that we're learning new care routines, or maybe we'll go to new places. I always find it stressful in the community when I'm going to different homes that I've never been before because I have to find them. So it's useful for you to plan ahead to reduce those. Again, there's lots of strategies there in what we need to do to reduce our own stress. It's important we find techniques that work for us. Ways in which we can reduce stress might be going for a walk, just eating more healthily, drinking more fluid, counting, breathing, relaxation and mindfulness. There's lots of activities in ways in which we could look after ourselves on a day-to-day. So let's now look at some of the theory in which you need to do to pass this module. The first question looks at a spider graph, and again, it wants you to identify the main points of legislation for health and safety at work. So I'm hoping you're going to write something in there about keeping yourself safe, or your employers keeping you safe, or reporting things. So that's what we're looking for here. In this one, we're looking for you to identify or describe policies relating to health and safety. So that could be riddle, cosh, fire. And here you list and you describe some of those key points around the policy and procedures. This one, we're looking around responsibilities. So under health and safety, what's your responsibilities? What do you think your employees' responsibilities are? And what do you think other people's responsibilities are? Showing a good understanding around roles and responsibilities. Here, we're going to look at training and things that you must have specialist training for, and we covered some of that earlier around medication and certain care techniques and movement and handling. Here, we're looking for you to explain 3 types of support that in relation to health and safety and where you can go. So it might be, for example, the health and safety executive, you're going online, I can assess that by going online or phone them up, and it could help me by, they give you access to materials or resources or etc. On this one, we're looking at different types of accidents and sudden illnesses. So we looked at slip, trips and falls, and we looked at epilepsy and diabetic emergencies, and what would you do in those situations. So you'll have to read your company's policies and procedures to understand what to write there. Here it wants you to describe 3 different types of accidents and sudden illnesses. So again, for example, if we have a diabetic emergency, what would I do? So I would calm them down, maintain their airway, maybe try and get a sample. A sudden illness could be the fact that they're going into a coma, and then what would I do if this happens? So again, I would call an ambulance and write it up, etc. Here, it's asking you to answer these and explain the importance of accessing the risks. So here, we're looking at moving and handling equipment. So again, think about kind of your hoist or a wheelchair, and again, what would you do if something wasn't right with it? Down here about providing personal care, so think about infection control, incontinence, managing people. And there we're looking at soiled linen. The next one, we're looking at risk around health and safety and identifying the agreed ways of working, and you need to describe that. So again, how would you report this and who would you report this to? So at that point, you're going to have to find your health and safety poster at work and know who your point of contact is. This one, we're going to line them up. So here you've got the legislation, here you've got a description, so you can either write the correct corresponding letter, or you could just draw lines. It's up to you how you compare them or match them up, but this is just a matching exercise. Again, another spider graph, so the tasks you must not carry out until trained. So think about other things that you're doing and customers that maybe you're working with, and further training that you're going to needs to be identified here. Here, you're going to list what a first aider can do, so an emergency first aider, and then what you must not do. So at the moment, you've only done BLS, basic life support, so you must know the differences between being trained and not trained. So at the moment you are not trained, and it's important that you know that. Here we're looking at key points for agreed ways of working in relation to medication. So we covered that earlier. Again, you will do medication as a standalone activity, and you should understand the relations to how to control medication. You've got the 6R, the right person, right dose, right route, and again, agreed ways of working, so you've read your policies and procedures. Here, we're going to look at tasks that you're not allowed to carry out unless you receive appropriate training, and you need to list 4. So again, around medications, that might be things such as dealing with specialist drugs or dispensing. Here, we're going to go down to COSH, the controls of substances hazardous to health, and we're looking at hazardous substances and why they're hazardous. So for example, it might be bleach because it's harmful, it releases the chemicals we breathe in, it can cause breathing difficulties, so all skin irritants. Here we're looking at complete the grid below to list the preventive measures for fire. So again, measures to prevent fire, so we covered those. You had the crosses and the circles, and not smoking, don't let waste build up and all that. And why? Because we could drop a cigarette, and most bedding's flammable. If we have lots of build up cardboard, it's a place to start a fire. Here we're looking at a process, so you need to obtain a copy of your fire procedures. Now remember, each building is different, so you can choose your head office or you can choose a customer's home, but you're going to write the steps in which you take. Now normal steps are, if I see a fire, I would raise the alarm. If there were bells, I would push them. If there are no bells, I may shout out fire, fire, fire 3 times. If I'm in a nursing home or a care service, I will follow their procedures. And each resident and each customer should have a PEP, a personal emergency evacuation plan. So you should know how to implement that. Here we're looking about dealing with safety and describe 5 ways around safety and security. So again, in people's homes, if somebody comes to the door, you're not going to let them in unless you know who they are. And if it's a commercial building and you're there, you're going to be checking them in, checking their ID, and if they haven't got that, you're not going to be letting them in. Here you're going to explain how you would deal with an unauthorised person. And normally the best principle for this is just asking, how can I help you? Let them know that you're watching them, and that in itself will probably be a deterrent. Again, we're not asking you to put yourselves at risk. We don't want you to become ninjas. We just want you to be able to tackle people and let them know. And then obviously you'll communicate that and pass that on. And here it's asking about confidential information. So think about when people are asking about reading care notes or care plans, if they don't have a right to read it, they shouldn't be reading it. So here we're looking about different groups of signs and symptoms of stress. So we're looking at psychological and behavioural things. So psychological might be the fact that I'm starting to get anxiety, I'm starting to feel pressure, I'm starting to feel worthless. My behaviour, I might start to be doing erratic things, I might start to be self-medicating, I may be doing other things to manage my behaviours. So again, things that we can put there. Another spider diagram here about managing stress. So think about all the triggers that trigger us. So family arguments, falling out, working under pressure, all of those are triggers. Here we're then looking at ways in which you can reduce that, and there was a page on all the things we can reduce: exercise, music, healthy eating, and all of that. So there's quite a lot there for you to consider under the health and safety. You will do, again, mandatory training around health and safety as a standalone course. You're going to do medication as a standalone course. You're going to do infection control as a standalone course. You'll do fire as a standalone course. You're going to do COSH as a standalone course. And you'll do moving and handling, again, as a standalone course. This is the minimum requirement to get you started. So once you've started, that's fine. You'll then find you'll be given access to either distance learning materials or maybe face-to-face training from your employer. It's important you attend those, because even though this care certificate is for life, we know processes change. And again, each workforce, each area has different policies and procedures. So thanks for watching. Hopefully you found that useful. Please get this completed and sent over to your assessor, and you'll receive your feedback shortly. And I will see you in Standard 14.